Thank you, Smeeta, for joining us. We're very excited to have you as part of our podcast about happiness and me. And I wanted to ask if you could just share a little bit about your journey into becoming a psychologist and what gives you passion to help people to help people.
I've always wanted to be a psychologist. Ironically, like when everybody just thinks in school, what do you want to be one day? What do you want to go and do as studies? I've always wanted to be a psychologist. So for me, it was just applying for that one degree, and this is what I got. Why I wanted to be a psychologist, I don't really know myself, but when I went into university for my BSc, this is one of the first questions that you get asked before they actually take you in, and then they would do a personality test just to know that you are prepared for that or not. And this is when I found out that why I wanted to do psychology is because I always wanted to understand myself, to understand who I was and also how everything works around me. Because I've always been this person with like a lot of emotions, like always hypersensitive to everything. And people around me were not necessarily like me. So when I went into uni, this is where I actually found out more about myself, understanding who I am and understanding people's behavior. This is when I realized why I wanted to be a psychologist, because I like to understand the logic and the reason behind people's behaviors, emotions, what they say, what they do.
Actually, that's really cool that you're saying this, because I know a couple of people who are studying psychology at the moment, and they also feel like, yeah, I'm getting something out of this for me, let alone, and then I get to help other people.
Exactly.
But yeah, that's amazing.
Yeah, to understand your own emotions, it's always better for you to be able to understand the emotion of others. Otherwise, it's very difficult. Yeah.
Smeeta, our theme for this podcast is happiness and me, so internal happiness. Can I ask you to start off with your definition of happiness? What does happiness mean from a psychological sort of perspective?
From a psychological perspective, it would be, well, the affect, but that is a very psychology part. But for, well, to just make it more easy to understand, it's about like being, having that positive feeling about little things that's happening. That's the short-term happiness, like little things that's happening on a daily basis in your life, just being grateful and being, enjoying it. That would be in the short term, and then in the long term, it would be like in terms of goals and achievements that people have set for themselves, and then they would find that positive thought, emotion in there. So basically that would be, from a psychological perspective, what happiness would be.
And do you sense that most of the patients that come to you, they would do so because they are pursuing happiness or they are lacking happiness in their life?
Some of them would be pursuing happiness, like just to try and understand themselves and what's happening within for them to have, like, to be a better version of themselves. Some people would come with demands like that, but most clients would actually come because of some psychological distress or some psychiatric issues, which then would be coming to discover what happiness is about. Because some of them would actually tell you that they have never had this sense of happiness throughout their life. And when you'd be asking them questions and you would see in their lives like the different patterns of situations that's happened, it's true, they had found it very hard to get that one emotion of happiness. So it depends on case to case as well.
And do you think there are certain barriers that people have, certain behaviors or thought patterns that hinder their personal happiness?
Yeah, there's a lot. Like some people would actually, again, it would come from the family system that they have grown up in. And some people would be like, you have to set the bar really high all the time in every aspect of life. And this is what they would try to do as well. But sometimes, like I told you earlier, everybody has got their own personality. So sometimes the way that one thing can work for a specific person, it's not necessary that it would work for the brother in the same family unit, because it's a different personality, a different way of seeing things as well. So when they would still try to get validated by the parents or by the family to set the bar high, they would not be able to do it. So there's a lot in terms of like life achievements, setting goals that would be quite not unrealistic, but it's not necessarily what that person as an individual would have chosen for himself. It's just what is being passed on from generation to generation.
Yeah, wow.
So, Smeeta, going back to the psychology of things, or the profession that you exercise in, at what point does unhappiness tip into the basket of depression, for example? Because we talked before, you can't be happy, happy, happy all day long. Everyone experiences, some times of unhappiness, discontent, but then they find themselves back, and I think the normal person would be overall,
Yes.
happy. But at what point does unhappiness become more of an issue and that goes into depression?
It's when someone would kind of like take notice of different emotions settling in. So when they are not content or happy about something or joyful about things, they would be feeling more negative emotions, which are completely normal as well. Like in terms of sadness, fear, anxiety, stress, these are normal negative emotions. But when it would become to a level where the person cannot control it, and then they would get overwhelmed by that, then you would tip more towards depression. When you feel, you're losing that sense of control over your own emotions and your own being, this is when sometimes people tend to tip there, because
Okay.
they just don't understand what's happening all of a sudden.
And would you say that this is then the point where they need to go see a psychologist, or even before reaching that point?
Technically, it would have been better if they came before. Some people, it's true, they would wait for like the very last minute and then they would come. When the depression has come to an extent where sometimes, we also have to refer to a psychiatrist for medication, because the emotion of depression is so high and so overwhelming that in therapy, even though we would try to work with that person, the person can see only that negative aspect because the emotional level is too high. So we are not able to help the person to rationalize or to stop on a specific thought pattern to kind of like change it into something more positive or more realistic. But when you send them to, you'd refer them to a psychiatrist or to a doctor, mostly psychiatrists, they would help with medication, which would decrease the level of negative emotion that's there. And then when that emotion is kind of like stable, not completely gone, no, but kind of stable, then the person would be more apt and more open and more receptive as well to what is being done and said in therapy.
Is there a particular definition of depression? Because maybe it's in Mauritius context. In the Mauritian context, I've heard many people say, "Oh, she's depressed," or "I feel depressed," and I don't think people really understand the weight of this concept.
It's true, in Mauritius, everybody would just like put depression as a word that, it just exists. It's not, some people would even say it's not a disorder. Like depression is not a real thing. It's just a state of mind, which is a state of mind, yes. But sometimes when people are just like sad or they're going through like a life thing during one day, they would say, oh, I'm feeling a bit depressed now. But it's not that. Depression, well, for us, the DSM is very important to see in terms of diagnosis. So depression, it's a negative feeling, yes, but it has to be there for quite a while, usually for 6 months. And then you can be diagnosed of clinical depression. But that also, it goes like into different stages. But sometimes during the beginning, the first phase, when you do feel like, you have lost, you don't even want to do anything and you are just there with that negative feeling. And some people would also describe it in terms like, physical symptoms where they feel that there's a weight here and they don't know what to do. They feel like crying all the time. They can't eat. Even when they are eating, it's not as if anything is going in, and they would not be able to sleep. Some of them would oversleep. So it's a lot of things. And again, depression and the feelings would depend from person to person. Some people can also, it can start with something very minor, but the importance and the way that some client would catastrophize on what they are feeling, it would lead them to depression eventually.
Well, that actually sounds like I'm sure there are lots of people who have someone in their family who they kind of those people are coming into their minds probably even now as they're watching, and I'm just imagining that as someone looking on who has a family member in such a situation, is there anything helpful that someone who's a loved one could do? I mean, I'm assuming it's not, come on, snap out of it, let's go, let's,
A lot of
get out.
people actually do say that.
I'm sure.
A lot of clients would come and they would
And
say
it
that,
doesn't help.
no, that they don't have this sense of understanding from their own family or their own friends. Because like I told you, in Mauritius, a lot of people tend to say that, oh, it's just depression.
Yeah.
And they fail to understand that depression exists in so many phases. So sometimes when you're feeling low for a day, it doesn't mean you're depressed. You're just feeling low.
Yeah.
But some people would actually say that I felt that the other day, but I'm fine now. Why are you not snapping out of it? So that is not the best thing to say. What I would like to say is that to, provide some kind of understanding to that person, asking like really how the person is feeling and if the person wants to talk now, or do they want like some kind of space first. Let them reflect on it, and just to let them know, when you feel ready, I'm here. You can come and talk to me about whatever is going on and however you're feeling, and then we'll find a solution together.
Yeah.
Because sometimes some people could get very overwhelming as well. Like they would be on you, like being persistent on telling them now, right now, what's happening and why you're feeling like that. But it's not always something that you can do.
Sometimes people have this fixer kind of mentality where they just like, okay, what's wrong? Let's do what we can to fix
Exactly.
it. But sometimes things take time.
Mhm. Like when clients would come into therapy, some of them would be like very impatient, like when am I going to be able to feel happy again? And this is what we tell them, like, even in therapy, we have steps that we have to follow. We can't just from today, like the next session, you'll be happy already. It doesn't work like that. And the same way that negative emotions or a diagnosis, an emotional diagnosis, has taken time to settle in, for therapy as well, it would be the same thing.
So in therapy, let's say someone comes to you and say, I'm dealing with grief, the loss of someone, I'm dealing with anxiety, I'm dealing with depression, let's say those three things. What would your strategy be? What would your steps be?
The first clinical session, it's for everybody, like in every psychological therapy, it's the same. So we would try to understand like what really happened in that person's life. Where does those feelings come from? Where does those thoughts come from? And then we try to work on a goal together with the client to know where we will go in therapy, like the therapeutical goals. And me personally, I'm a CBT practitioner, so cognitive behavioral therapy. And my way of working would mostly be towards like what are the thought patterns that got changed at some point in time that led to those kind of emotions in them, and then the behavior. The behavior would be considered as being the symptoms within the diagnosis in itself. And then we work in the reverse order. So for me personally, like to try in CBT, what we try to do to change the whole behavioral pattern of that person within the diagnosis, we have to decrease the intensity of emotion first. And this is when I was telling you, in some clients, we have to refer also to psychiatrists to get it done. Not in all cases, but in some cases where, for example, someone would be suicidal, then yes, before trying therapy, the first step would be a psychiatrist. And then we can get there into therapy, decreasing the emotional pattern. And in anxiety, for example, when you'd be decreasing the emotional level, then all psychosomatic symptoms, for example, panic attacks and other emotions or other physical symptoms would also go down. And to be able to do that, we have to work with the distorted pattern of thinking that got created with regards to a specific situation that created that.
What sort of distorted patterns have you seen, come across that maybe are the most usual, typical?
In Mauritius, a lot of people, I don't know if it's a whole generational thing or it's like just gone family to family, like a lot of people would come in any ages, but that one pattern of thinking would be there, like I'm not good enough, I'm not good enough, or I'm not going to be able to do it. These kind of things, it's very, very ancré in most clients that we see.
Is it a disappointment? Do you think it's society's expectations put on them, and then they feel like, you know, my parents expected me to become a lawyer, a doctor, and
You know,
I'm
in
not able.
our context, like of education that we receive, there's a lot of competition going on there. And why I'm using this as an example, because this is one of the things that most people would say. Every time that we would try to go in the past, they would kind of pinpoint, you know, when I was at school, this used to happen. I was being compared to other people, or I was being compared to the class. Teachers used to say that. Parents used to have those kind of expectations. So they grew up, like some people would even tell me, like the other day, there was someone who came who was going to do the A-levels exams now, I think it starts this week. And for her, she was having massive panic attacks. She didn't know how to continue her revision and to go for exams. And for her, when we went back into her childhood, when she was getting 95, for example, in her primary school, it was not good enough. So instead of like being said, oh, that's very good, she was being said, oh, but you could have also got that 5 points. You have done like silly mistakes. And this is something that she grew up with. She's extremely intelligent, but she's not able to even see that in herself. And a lot of people would actually tell us that in therapy. That's the most basic thing I'm telling you here.
So what you're saying is that these little things, these little jibes that maybe we say to our kids, oh, yeah, well done, but you could have gotten better. What went wrong, or that kind of thing. These are things that stay with them through their life, and then like later on, if they have some problems.
You know, some children, like I told you, it depends on personality of the person a lot, because some children would just take it in and it's okay for them. They don't pay attention to it. But other children who are having other things that's happening at the same time. For example, this child, she was also going through bullying at school. So this was already affecting her self-esteem and her self-worth at that time. Now to listen to, like for her, okay, I was not good physically, but I was good in my education. Now you come and you say something like that, that person automatically, because the pattern of thinking has already been distorted, so they would focus on the negative part again. So the whole self-esteem gets built up on that.
So I suppose, in a way, knowing this, and I hope that a lot of people listening, a lot of parents listening, they would, you know, take the time to think about what they're actually saying to their kids, because that has the long-term impact. But for those people that have, you know, their childhood is way past behind them, so they are now in adulthood, they're 30, 40 years old, and this is still there.
Yeah, it is.
And they come to you and they're saying, they're exposing their past. What do you tell them?
Again, that would depend on the problematic that the person is coming for in therapy, but that would be the first stage of therapy, like to go into childhood and see what are the patterns of thinking that was created there.
But they can't change the past.
No, we can't change the past. This is what we always tell them in the present. Like you can't change, because some people some adults would come because they are very angry with their parents. And you know, the only thing that the parents did was like put pressure onto that child. But again, this is what we try to make them understand in therapy. We can't change the past. We can't change the traumas that has been done at some point in time. But what you can change today is the way that you choose to see your life as from now. Like instead of focusing on everything that you think was not good enough, let's focus on the things that you were able to achieve, because there's so many things that that person achieved. And also to try and make them reconcile with the relationship with their parents, because I don't think parents do that deliberately to harm their child. This is the parenting that we got. So some people it's just automatic, because for them, well, it worked well, so they are going to use it on their child. Some, like I told you, some children would be so sensitive to emotions that they would not be seeing it the same way that the parents saw it when they were 5 years old. So these are things that needs to be worked with then, because there are a lot of people who, for example, their parents now, who's very old, are suffering from like illnesses that cannot be cured, but they are not able to fully leave the relationship because they still have that grudge somewhere with them, which is not worth carrying sometimes.
Smeeta, we've heard about CBT. You mentioned CBT, cognitive behavior therapy. What does that actually entail? What are the steps involved?
In CBT, you have like different stages, and like I told you, the first step would be to work on the past of that person, to go and try and see what are the core beliefs that's there. In CBT, the core belief is very important, like the belief system, where does it come from and why is it so ingrained in that person? Because the people, they would be completely believing into that, even if it's not logical or rational. So that would be the first step, to go and find out how their personality, how their self-esteem and self-worth has been created. And then we move on to the second phase. So the second phase would be to kind of find out what are the thought patterns that exist in the present moment, which are negative automatic thoughts. Automatic, why? It's because the person is not going to sit around and just think about things. It's just like overthinking. Negative pattern of thinking would just come. The one thing that we see here is that in CBT, it's either the person would be catastrophizing the whole thought, or it's like the all or nothing thinking. So it's just that. And then when it's one thought, how they catastrophize on it, it would be like they would take all little things that happens in their life, which would be negative as well, and they would mix everything together. They fail to see that, each problem that they are having in life, it's different. It's not something that would just, the triggers are not the same. Like the triggers would not be the same, so you can't treat everything together. You can't have the same feeling, intensity of emotion for all of it. So what we do then, we have to break it into pieces for them to make them understand, okay, so in this particular trigger, what is the thought that's there? And do you think the emotion that you're having right now, or the intensity with which you're feeling it, do you think it's adapting for that or not? So you'd kind of like break it into little things. And all or nothing is like, even if a person is in therapy, like we have to continue live, right? So daily life continues. And they are still having like other issues that's cropping up in their daily life. So what we do is that along with working in the past, we also have to work with the present. So what's happening, and we would go there and we would try to rationalize those thoughts for them to begin with. So rationalization would be the second part. In the second part, you have rationalization and you also have normalization. Rationalization would be when a negative emotion is not actually appropriate in that situation, or the intensity is not appropriate. So you change the thought pattern into a more realistic, a more rational, logical one, for that person to be able to change the emotional state and the behavior towards the end. And then you also have normalization, where normalization is just like negative emotions or emotions as well. So sometimes you just have to accept. Accepting is another thing that is very important in CBT and in therapies in general. Like, unless someone accepts things that's happened in their life, they can't change it. So a lot of people would not be accepting. They would keep on asking, but why did it happen to me? Why did it happen to me? Why am I the only one who's like having this issue? Which is not true, but for them, they can see only that. And this is how they catastrophize things for them around in their life. So that would be the second phase. And then the third part is the relapse prevention. In CBT, there's also the exposure. So the third phase of therapy would mostly be on exposure-based therapy, where with everything that they have learned in therapy, how to take control, like to identify the thought pattern, take control of it, change it into a more positive, rational one, decreasing the emotion. Now you have to adapt it in daily life. So then they have to go into exposure, things that used to make them anxious before, or depressed before, or fearful before, to just be there and see how it goes. With all the coping strategies that they have learned in therapy. Why this phase is important, like I said, it's for relapse prevention. It's because, like, for a baby, for instance, when they are learning to walk, if they fall and everybody just like, oh my God, don't do that, the baby will be scared as well and wouldn't want to try. But if the same thing, you say, no, let's try, and I'll hold your hand, and then you let him go, like gradually leaving him. he will see for himself. So he will learn for himself, oh, I've got the capacity to do it. They build their confidence from there. So this is why exposure is important. Like, you let the person have their own experience with positive beliefs, and then to see that things are actually going well in my life when I behave like that, when I think like that. So then this is the thought pattern that becomes the automatic one.
If we were to actually, I mean, this is the theory, and I understand
Yes.
parts of it, but if we were to bring it down to a sort of real scenario, let's say the example you took before of this child who's going through A levels and then feeling anxious and like, I will never make it, and having panic attacks. So how do you go through the steps of CBT with that person?
So in the first step, this is what we did with her. So we kind of like went backward to know what happened in her life since childhood till the present moment that she came into therapy. Like, what were the negative situations or the traumatic situations that the person went through? What are the belief systems that every time that she was going through a life event, what came out from that? And then in the second session, what we would do, in the second phase of therapy, what we do would be to get the thought pattern that exists in the present. Like I told you earlier, in the present, it would be termed as being automatic negative thoughts. But what we do is we have to show the person where these thoughts come from. So then we link it to the past, and every time that she was in a similar kind of situation or similar kind of triggering event, this is the thought that was coming. But then to adapt it to the present, does that thought, with everything that you have also achieved in life, does it still stand good in the present? For example, a lot of people who would have these kind of thoughts in A levels, in O levels, they did extremely well. And they would still have it in A levels. So just to make them focus on, even in O levels, you're the one who made all the effort, you're the one who actually worked, you're the one who did everything, and you got the results. So now the thought that you're having, I'm not good enough, does it really stand good? Taking also into consideration like the present, where that person has been extremely structured with regards to her revision, to her working on different like papers and everything, the results, the tuitions, everything that's been happening in the present, to show her it's the positive part that's more prevalent compared to what she had lived in the past. And also to make them understand sometimes, like, to get 100 or 95, is it really such a big difference? Like, you would still go to university to do the same thing, you'd still work in the same field that you would want to work. It's not really such a big deal.
So what? Even if you have 90 or 95, so what?
That's a question that I ask a lot. Not like that, but I would say so, because I can't quite understand the logic behind. And usually they would laugh when I say that, because by that time themselves they had seen that, their pattern of thinking was not really the same. So, and then the third phase would be like they would actually go into exposure. So the exam starts this week, and see, like with techniques of decreasing the panic attacks as well, like relaxation techniques that I gave her during that session, how she adapts it for her not to have a panic attack. But sometimes there were other people as well. If the panic attacks are too recurrent, then I have to refer to the psychiatrist, like to get something just so that they can do their exams properly without having one.
Yeah. I'm sure there are so many people that would want to reach out to someone such as you or your colleagues who are psychiatrists, or someone to get some help. But I feel like there's still a lot of stigma around mental health, or the idea of having to ask for some kind of psychological help. It's like, how is that going to make me look, and What would you say to that?
It is true. There's still a lot of stigma with regards to mental health in itself in Mauritius, like amongst all ages. It started to decrease a bit because more people are becoming more and more aware, and more people are having actual mental health issues as well, because life is becoming so stressful. So people are becoming more aware. But sometimes, instead of judging someone, maybe it's better to understand, like I said, like what that person is trying to say or what that person is really feeling. And then if it's really like the route for that person to get help, to encourage them, because each person has got their own battle, right? And we don't know how someone is processing things unless they tell us.
I always think isn't it better to ask for the help to go, like, because what would be the worst thing? The worst thing is that that person ends up ending their life because they can't think that they would go on. So it's better to humble yourself and kind of,
Exactly.
be at the risk of
But with
embarrassment.
regards to this type of issue, it's very important that the client themselves feel ready to be in therapy. Like, you can't force someone. There's a lot of people who would also advise, like the person going through a mental health issue, go see a psychologist or psychiatrist or doctor. But unless that person is ready, there are some family members who had brought their family member who's going through mental health issue into therapy as well. But the first session itself, it doesn't go that well because that person is not in that, frame of mind that I am actually going through something and maybe I need help. That session is very important because this is where you would shape that person's thinking about what it actually is therapy and why is it not such a bad thing. And then you just let the person go, like telling them that, anytime that you personally, you feel ready to come back, then of course, you can book an appointment. They do come back. Most of them have actually.
That's great.
Yeah, I mean, it's hard though, because if we understand the Mauritian context, people really look at what, or they consider what other people think. And it's a small country. People know each other, and so it's a bit of an admission of weakness if you kind of say, well, I'm going through emotional, stress, or I am, stress may be acceptable, but, mental health issues, I think it's still very much a sign of weakness. And so who can they open up to? Because I feel a lot of Mauritians cannot even open up to their families.
No.
They can't open to their friends about it because I'm going to be seen as a weak person.
Yeah. This is what I'm telling you, like the first part of the job has to be done by the person himself, like to kind of understand that, me feeling these negative emotion is not a weakness. So me speaking to someone about it does not equate to me being weak. But sometimes they do, some of them wouldn't even, they would come into therapy and they would tell me, no one knows I'm here. Now, depending on the age of that person, because sometimes when it's adolescents, ethically we have to inform their parents, so that is another part. But when sometimes even adults, like grown-up adults, like in their late 40s
So
or 50s.
they won't tell their wife or
No.
even husband that
No,
they've...
they wouldn't.
Wow.
They wouldn't. And this is something afterwards, like in therapy with this type of issues, depending on the triggers as well, where we would encourage them at some point in time to bring their partner and to kind of speak about it for themselves to feel free, and that, for them to understand that talking about my emotion in my house is completely normal, and to encourage them to this is what you want to transfer to your child, not transfer the part that talking about emotion is a weakness. Like, people would often say men shouldn't cry. A lot of clients who are males would come into therapy and they would tell me that. They would tell me, I'm really sorry, I'm crying. Why are you sorry you're crying? They would just say, because I'm not supposed to.
They've never seen their
No.
dad cry
No.
and being emotional, so obviously they role model that now.
Yes, a lot of clients actually say, they would say they are sorry that they are crying. This being female or male. You have the right to cry. If you're feeling sad, this is the most normal thing to do, to cry. Like, normalizing negative emotion, it's not quite normal for some people. Yeah.
And what about the use of medication? You said before that for the A-level student, you did refer her to the psychiatrist to prescribe something so that she can go through the exam. Like, if someone says, well, I've got a long-term sort of intervention with a psychologist, or I have the option of getting drugs, medication from a psychiatrist to get better quickly. What do you say to that?
Usually what we say to them is that that's their choice to begin with, but it works together. like we work together, psychologists and psychiatrists, on many cases, because sometimes, like I told you, some client would come in and they don't require therapy, but they require medication as first step. So what we would do is we would refer them to the psychiatrist. And same, like if someone went to a psychiatrist and the psychiatrist sees that this person does not require medication, but more therapy intervention, they would refer. And sometimes we have to those clients have to be in follow-up with both of us, like both psychologists and psychiatrists. And this is actually what works best, because the medication is there to decrease the intensity of emotions felt. But to change the thought pattern, the medication won't do that. So this is what the psychiatrist then explain to the client and then refer them to us psychologists, like to work on that part, because the day that you stop medication, the thought pattern would still be there because the triggers are still there. So sometimes you have to work with both of them, but sometimes, like I told you earlier, when someone comes with like high intensity of symptoms and emotions, they won't be able to work in therapy, even though we try. There was one OCD patient with whom we really tried, because that person was extremely against medication. We tried for first 3 sessions, usually with OCD cases, depending on what type of OCD. The third session, we have to start being a bit more rational. This person was not able to, because he was so compulsive in his behavior that he couldn't think of something else. So I had to call in, he was an adult, well, a young adult. I still had to call in his parents with him, with his permission, of course. And then we did like session with all of them for them to really understand why medication also would be important in his treatment. Only therapy would not be working, and the person would, coming from like OCD, if we leave that person just be in therapy and just say, yeah, come, I will continue therapy with you, and we would see in the long term. I'm kind of like, if we do that, there's a risk that that person falls into depression, because in that person's head, I'm doing everything to get better and I'm still not getting better. So then they go into the depressive phase, which ethically we can't let that happen. So this is why that session had to happen, for them to understand. And he eventually did go to the psychiatrist. He did get medication. He went stable for a month. Now we are continuing with therapy. And it's easier for him. This is what he said. Now I understand what you were trying to tell.
Okay.
Yeah.
And oftentimes the going on to medication is not necessarily for life. It can just be, like you're saying, like with this tandem, like it helps. So have you seen many people that, like, you think, oh, they could be on medication for quite some time, but then after a while they really work on themselves and then they get off the meds?
Yes, there's a lot of people, well, there's different types of diagnosis. Some diagnoses actually need that person to be under medication for life as well. But this, the psychiatrist and the patient would decide depending on what kind of diagnosis it is. But some emotional diagnosis, you don't need to be under medication like your whole life or for a long period as well. It's just there to help you, like, get a grip of yourself and your emotions, to work in therapy. And then when therapy starts to work, the psychiatrist starts to decrease the medication, and we work together until the patients like just go off
And
it.
have you ever seen cases where patients would, or maybe they're not actually patients, but they end up coming to you? Have you ever seen people that try and self-medicate with off-the-street drugs and, like, you know, illegal drugs to try and help themselves?
There are some people who try to take their parents or their family members' medication as well, because, for example, someone was going through anxiety. They did have anti-anxiety medication at home. And then this one person is there and for one day, or like, you know, is having anxiety as well. Without consulting someone, they would take that. This is not the right thing to do, because medication has, it's specific to the case, it's specific to the person, the dosage is specific as well. This is why the psychiatrist is important.
But when it comes to, let's say, illegal drugs, have you ever seen people trying to numb themselves because they have underlying psychiatric issues? Or?
A lot of people use this as coping mechanisms. Like in anxiety, you get that a lot as well, because they would want
drugs
to,
or alcohol?
Drugs or alcohol. They would try to stop the overthinking that happens in anxiety. So they would take that just to make their brain go numb, but at the same time, it's just like a toxic coping mechanism at some point in time, because then they develop another thing, which would be addiction.
Sure.
So then
It's just putting a
instead of working
toxic,
just
dirty
on
Band-Aid on top of a
Exactly.
problem that,
Instead of just working on that anxiety that would have been easily resolved, they go into something which is worse.
yeah, yeah.
Can I ask you, I mean, you mentioned before that the most common source of, let's say, unhappiness from the patients that you see in Mauritius is that feeling of inadequacy, that they're not good enough. And I suppose, like we said before, it's because of their history, the generations that came before them, you know, they send them to school, and I gave you everything so that you can become doctor or lawyer or whatever, and that person is not one of them and feeling inadequate. I can understand
That
that.
person could be a very good engineer,
Yeah.
but they would still be like, oh, I was not a
Yeah.
doctor.
Or they see their friends, you know, becoming doctors and lawyers, and they're like, I'm 35, I'm 40, I'm, you know, 45, now realizing that this is the life that I've created and this is not what my parents wanted me to do, or even I had, you know, set for myself. What do you say at that point? How do you get them out of this thought pattern?
Again, it's for them to understand, like to make them try and reflect on what they as an individual have always wanted in their life. Like what make them happy, what kind of things actually they can relate to, and they feel that, you know, when I go to work in the morning, I'm having that sense of like accomplishment, and also I'm feeling fulfilled with regards to what I'm doing. You don't have to be what your parents wanted you to be. You doing what you are doing today is okay in terms of the lifestyle that the person wanted, in terms of like job satisfaction. Just make them change their focus onto why they chose that field and how good they are in that. Like they don't have to be what exactly the title that their parents wanted them to have one day. And some of them would actually say that, you know, anyway, I'm scared of blood. So like, yes, that would have been like a very logical reason as to why maybe medicine wouldn't have been the perfect choice to begin with.
But what if they did start, and what if they did apply, and then they realize they're not good enough for it, and it's
Yeah,
like a
some of
dream
them do.
has been broken? And how does one recover from that without feeling like, well, I can only settle for less now, and that's going to be my life?
There we have to work usually with like, the first part is the acceptance phase, like how and why it happened, and why it would be more beneficial for you today to accept that it didn't happen, and being given that happened, how other happy things happened in your life. Like from one negative source, there's a lot of positive things that came out actually. So to change the focus on like what actually happened as from there, and what that dream of being like a specific expertise meant to them back then, and what would it have mean today. Like sometimes, you know, what we thought when we were 20 and what we think when we are 41 is not the same. So just to place them back into their life where they are today, and maybe how that same dreams and goals wouldn't have worked today.
And I took the example of career, but then it does apply to other spheres as well. For example, a lot of people would say, you know, I'm 35 and I thought that I would be married with the love of my life by now. You know, I don't have kids and we've been trying, and I would have thought that I would have 3 kids, you know, and having a happy family. And, you know, should I just settle for less?
That would depend on the triggers, like why that person was not able to achieve their dream by that specific age. And sometimes it would be like unrealistic by 35, especially if you wanted to be like this kind of expertise job-wise, and then you wanted to specialize in that thing. That in itself has taken like so long. And then by the time that you found the right person to get married, and then you wanted then to build a house, to have that and other things first, and then to have a child. So like what happens in those different steps that hindered that, and why it was not possible, and why it's still not late for you to have that child that you wanted if there's no medical complications linked. Because in CBT we have to take into consideration also like all these things to stay as real and rational that we can in terms of the rationalization process. So For example, even for people who would come with like medical phobias or medical anxieties, that person has to do a medical test first, just to make sure that it's not just a thought. Then you can start therapy. So it depends on what are the stages that the person have gone through. Yeah.
So, Smeeta, as a final question, what would you give as advice or pointers for people listening to cultivate a sense of happiness and contentment in their life throughout the various stages?
Throughout the various stages, I think it would be like to be mindful and grateful maybe about like little things that happens in our life on a daily basis that, you know, is quite positive as well. Maybe sometimes we just kind of think of like the bigger picture and where we want to be, forgetting like, you know, what are the little things that's happening today. And this is what actually makes us happy and maintains the happiness that we want to feel.
Yeah. So gratitude every day for the little things in life that you
Because
like.
sometimes life goes so fast, like during a day we've got 10,000 things to do that we don't pay attention to those little things that's there that actually is happy and helpful to us.
Yeah.
So paying attention to those little things, the combination of them actually makes a happy life.
Exactly.
Yeah.
Great.
That's great.
So on that note, we wish to thank you very much for being here, and on your birthday, happy birthday.
Thank you.
Thank you very much for sharing
I'm
your
sure our
time.
listeners have learnt a lot from you today, so we say thank you again.
Thank you for having me.
Yeah, all the best.
Yes, thank you.